Hello guys, so it's a one and only celebrity radiographer. Today I want to carry out an ultrasound of the bowel loops. I've gotten a lot of comments and a lot of requests to do this video because a lot of persons have been finding it difficult to do bowel ultrasound accurately. So in this video, I'll try my best to be able to carry out the ultrasound of the bowel loops in a very easy way so that you guys will be able to understand it, and from now henceforth you'll be able to carry out good ultrasound of the bowel loops. So before we start, there's some basic things we need to just note about the bowel loops that's very significant to different segments of it. Firstly, the small bowel loops. As we all know, the small bowel loops have some projections within the lumen, which are called valvulae convenientes, which we use to differentiate them sometimes from the large bowel loops. The large bowel loops have what we call haustral margins. So those haustral margins are going to be one of the major things that are going to help us to be able to delineate where the large bowel loops are on the ultrasound. So I'm going to go in right now. I have my colleague here. So he has given me full consent to carry out this video. So in case of any time you guys see his face during the video, so he has given me full consent for this video. So let's go into it right now. So basically, when we are carrying out the bowel ultrasound, anatomically, we know that the large colon starts from here, the ascending starts from here, and then the transverse goes around here, while the descending comes around here, then the sigmoid down to the rectum around this region here, like this. That's how we see it anatomically. But basically, in when you're going through the human body, it varies in different person's body. So the normal pattern that you know it to be in your textbook is not always like that. So you can have the large colon, the ascending colon coming up like this, and the transverse might come downwards and loop around like this. So it won't really just go straight down like this. So while we're doing the ultrasound, you have to be able to have that at the back of your mind and follow it, that pattern, or just try and move your probe around that region to see if you'll be able to locate where the loops are. So same thing around this region too. We might have some of those issues. Also, it might not go straight the same pattern that we want it to go, or the way we see it in our textbook. And then thirdly, another thing I want to make sure mention is that once we start from the stomach around this region and we get to the duodenum, it's always very difficult to differentiate the jejunum and the ileum. So we just categorize the both of them as one, and then we assess it together. So it's very difficult. Just know that at least the jejunum is at least upward, and the ileum should be a little bit downwards towards the region of the terminal ileum where it connects to the ascending colon. So what I'm going to be doing is that I'm going to be using two different type of probes. I'm going to be using the curvilinear probe. I'm going to be using this one, and I'm going to be using the linear probe also. So this linear probe is the best to assess bowel loops, while this one is just to get more deeper structures. So I'll be using this linear probe at first just to get the general overview of how the bowel loops are looking. Then I'll use my linear probe to get good assessment of the bowel loops. So right now, we're going to start the examination. So I'm going to show you guys how I follow through on this examination. Okay, so I'm going to start at the epigastric region over here like this. So you can see here, this is the pylorix part of the stomach. So let me just increase the depth a little bit. So this is the pylorix part of the stomach just here. If I move the probe towards this region, the left hypochondriac region here, like this, we'll see gas shadows. This is just the stomach. So from this region now, I will just start coming like this into this region. And here, I can start seeing the pyloric part. And just below here, this is the pancreas. So I'll move to this region, and then I can see it getting into the duodenum here like this. So now to really get that C loop shape of the duodenum on ultrasound sometimes is a little bit difficult, but this is the duodenum here, and this is the head of the pancreas, just around this region here like this. So from here, the connection to the jejunum is almost impossible to really get it very well on ultrasound. So, but nevertheless, if I should move my probe down from the epigastric region, once I start going down here, you can see these gas shadows here like this coming up around this region. This is actually the transverse colon. So I'll get past it and come a little bit towards the central margin like this. And then just superficially, if I should switch to my linear probe, we'll be able to see the jejunum and the ileum very well around this region. So his is a little bit empty, so it's not giving us what we really want very well. Just around this region here like this. These are the small bore loops. These are the small bore loops. So if you switch to the linear probe, you see it more clear. And what I said earlier is that the jejunum and the ileum are not really you can't really demarcate them. So we really just do them together and assess them together as the small bore loops. So we follow the whole of this region here like this, and then we just assess it to see how broad peristalsis, like you can see this. I'll switch to the linear probe and then you'll be able to see how it is properly. But I just want to do an overview so that you guys will see how it is with a curvilinear probe and in respect to other anatomical landmark. So once I come down to this region here, where we are supposed to have the terminal ileum, just around this region here, like this, we can see the psoas muscle here, psoas major muscle here, and once I come a little bit lateral to it, these gas shadows you're seeing here, this is the ascending colon going up. So I'll follow it like this. The whole of this region here is the ascending colon. Now, I want you to take note of something here like this now. You can see the gas is appearing a little bit bigger. This whitish thing here like this now, this hyperechoic um, markings you're seeing here now, those are due to the haustral markings. That's why you can see them very big like this. So those are the haustral markings. So you will notice this kind of gas pattern throughout the entire colon. So I'll follow it upward like this till I get to this point close to the liver. So I'll come down here. I'll start from here. See, this is the colon here. I'm going upward. So let me reduce the depth a little bit. So you see where the flexion occurs. So I'm going upward now. And then around this region here, we have the flexion around this region here, like this. And at this region here, I will turn my probe axially, and now we can see I'm going into the transverse colon. So I'll start following it like this, and this is it. This is it. Yeah, this is it. This is it. Now, just as I said, it does not really move straight the way you see it in your anatomical textbook. So you have to follow this gas pattern up here. That's what's going to guide you within the colon. So I'll follow it this way. I'll follow it. I'm still going. Follow it down to this region here. I'll follow it down to this region here. Then at this region here, we can see there's another region with the gas shadow is becoming obliterated. Around this region, the gas shadow is becoming obliterated here. Like that's to tell that there's another flexion around there. So I'll start turning my probe a little bit too. Still looking for the gas shadow. This is the gas shadow here. I'm still looking for it. If I just keep on going down like this, I will miss it. So I have to trace this gas shadow and see if it's extending towards this region here, or if I should come towards this part like this. So all I have to do now, go back there, apply a little bit of gel. So I'll go back to that region and then trace. So at this point now, I can see the gas coming this way. I'm beginning to lose it a little bit. I'm beginning to lose it. Okay, so came came down like this, came down like this, and then went sideways. So this is it. This is a continuation here. So same thing, these are the haustral markings. These are the haustral markings over here. So I'll follow it downward, downwards, down to this region here. And I can also notice another flexion here, another point in which it starts obliterating just around the psoas major muscle around here. And then same thing, I will turn the probe this way again and then start looking for it. Majorly, what I've noticed is that at this point of the sigmoid colon, it's always very difficult for you to be able to get it very well. But this is just it here like this. So you can see it obliterates. It's going backward, like into the retroperitoneal um, part of the stomach, of the abdomen, sorry. So it's hard for you to be able to locate it very well. So what I do most of the time is that I come straight down to the bladder, get the prostate, and just below the prostate here is the rectum. Just below the prostate here is the rectum, and then I turn it sagittally. Once I turn it sagittally, I can see it like this, and then I trace it back, the whole of this region here. This is the rectum here. Gas shadows, that's why you're seeing all these hypoechoic markings here. And then I trace it back up this way. And then this is it here, like this. This is it going up here like this. So that's it for the curvilinear probe. So I'm going to switch to the linear probe now, so we can get good visualization from the linear probe. So the same thing, I'm going to come up here around this region here. So at this point, just at the point of the pylorus, so this is it here. I'm going to trace it down towards the head of the pancreas. Head of the pancreas over here. Head of the pancreas over here. This is the pylorus. And then I'm going to run down. So we have gotten past the transverse colon. This is the transverse colon over here, giving us this haustral gas shadows here like this. I'm going to get past it and come down towards this region here, and then run my assessment of the jejunum. This is part of the jejunum here. You can see it. This is it. I'm going to run through it. This is the jejunum. This is it. So you can see the small bowel loops. They are all empty. They are not dilated. If they were dilated, we'll be able to see the valvulae conniventus. And then I'll keep on going that same way. I can trace the small bowel loops. This is it here. I can trace it downwards This is still part of the small bowel loops. So the whole of this region, you can see peristaltic wave moving in. So these are the small bowel loops. So I can assess the whole of this region like that, trace it down to this region here, where we get to our terminal ileum. So we are close to our terminal ileum here. So we're close to our terminal ileum over here. Let's look for it, where it drains into the large ascending colon. So just around this region here, if you trace it here, comes this way, comes this way, comes this way, and then connects with the ascending colon here. So this is the ascending colon here. You can see the gas shadows here like this. And then I'm going to turn my probe this way, and then you start seeing those same gas shadows that have been due to the haustral markings straight up this pathway like this till we get to this point of the liver where there's a flexion here, and when we get to this point we are going to turn it axially and continue the same pattern, the gas shadows. So majorly this gas shadow prevents the visualization of the lower part of the bowel loops down here. So we're going to follow it there. This is it. This is it. I'm still going through it. Still going through it. Down to this point here. Down to this point here. You can see it going downwards here. You can see it going down. I'm applying a little bit of pressure now, so I don't miss it. This is still it here. So I'm turning it downwards now, going down the descending colon, just beside the psoas major muscle. We've gotten to this point here now. There's another flexion here. So we're going to turn the probe. I'm going to turn the probe and look for, okay, sorry, this is it here. You can see it there. Then passes down. So we get down to this region here. These are the small bowel loops. These are still part of the small bowel loops. You can see the valvular conniventis patterns within the small bowel loops. So when we're using the curvilinear probe, we could not really see this very well, but with this we can see it very well now. And then I get to behind the urinary bladder over here. Then follow it down to this point here.